Hello everyone. In today's episode of Cracking Addiction, we delve into the complexities of gambling disorder in Australia, exploring its risk factors, diagnostic criteria, and both psychological and pharmacological treatment options. So, gambling disorder, what is it and how do we treat it? Well, first of all, we need to look at the local context in Australia. According to the Australian Institute of Health and Welfare, in 2023, their report suggested that Australians lose approximately $25 billion in legal forms of gambling each year, let alone all the illegal gambling. And that breaks down as follows. So 3/4 of us in the last 12 months engaged in some kind of gambling product. And 64%, that's lotteries or scratch cards. 39%, that's race betting, so betting on the horses, betting on the dogs, sports betting, and then 33% betting on pokies. So 3/4 of us have been involved in some sort of gambling. So it's a big problem. The risk factors for gambling I break down as follows. So constitutional gambling is particularly a problem for young males. It's also unfortunately found in people who are experiencing poverty. And there's the irony. They're the ones who are the least able to sustain gambling losses. And then we have certain behaviors that are associated with gambling or risk factors for gambling. And that includes not wearing seatbelts or carrying weapons. And then we have comorbidity. So if you've got a mental health disorder, an anxiety, depression, ADHD, etc., you're more likely to have a gambling disorder. If you have a substance use disorder, you're more likely to have a gambling disorder. If there's a family history of gambling, or if you've got a past history of trauma. Now, going back to the substance use comorbidity, it's interesting to note that the DSM-4 actually demonstrate or classified gambling disorder as an impulse control disorder, whereas now in DSM-5, it's actually listed in with addictions and with substance use disorders. So that speaks to the shared underlying pathophysiology that is the current thinking, that it's more really an addictive behavior. So how do we assess gambling? Well, there's two of my favorite ways are the lie bet questionnaire and a questionnaire called the PGSI. And we'll go into a bit more detail. So the lie bet questionnaire really revolves around two questions. Have you ever felt the need to bet more and more money? Or have you ever had to lie to people that are important to you about how much you gamble? And a yes to either of those questions indicates that the person needs to be referred for further assessment. And what does that further assessment look like? Well, it looks like the PGSI, so the Problem Gambling Severity Index. It's got 9 questions and a score of each question from 0, 1, 2, or 3. And overall, if you score 8 in the PGSI, that's roughly equivalent to a DSM-5 diagnosis of gambling disorder, which itself requires 4 criteria. Now, I'm not going to read out the questions. You can see them on the screen. Suffice it to say, the PGSI, a score of 8 or more indicates a gambling disorder and would be equivalent to at least a mild gambling disorder according to DSM-5. So I've mentioned DSM-5. So what are the criteria for gambling disorder in DSM-5? Well, I use the mnemonic CLERIC R.I.P. We need at least 4 criteria for the following. So the inability to cut back, lying to friends and family, using gambling as an escape, and also this reminds us, the E reminds us to exclude mania as a differential diagnosis. The harm for relationships, ongoing irritability, chasing losses, that's a key thing. Chasing losses is a key diagnostic criteria. Rescuing, needing to be bailed out by friends and family. Gambling, increasing amounts, a bit like substance use consumption, increasing amounts. And then being preoccupied with gambling is another criteria. So those are the criteria for gambling disorder. You need at least 4 to make the diagnosis. And a quick thought on severity. So, low risk gambling is defined as losing less than $100 on any one occasion or day, but also the cumulative loss per year being less than $100. So that's not to say that losing less than $100 per day, but you can keep gambling every day, because if you're losing $50 a day, after 3 days, your losses are going to exceed $100. So low risk means that you meet the criteria for both. So less than $100 per occasion or per day, but the cumulative total over the year is still less than $100. If you meet that, then you're low risk and it's probably not an issue. Now, there's another way of thinking about gambling disorder, and this is not actually in DSM-5 or, for that matter, ICD-11, but you can think about gambling disorder in terms of subtypes according to comorbidity. So we have the addictive subtype, and that speaks to the fact that gambling disorder is now listed in DSM-5 as an addiction. And the addictive subtype, no surprises, there's comorbid substance use disorder, and it's usually alcohol. Usually affects males, and there's usually small amounts of cash being lost. The impulsive subtype, that's usually associated with comorbid impulse control disorders like ODD or conduct disorder or intermittent explosive explosive disorder. And that's got an association with strong cravings. It predominantly affects males, and it's associated with losing large amounts of cash. And then we have the obsessive compulsive subtype, and there's comorbid mental health disorders, including depression and anxiety. It's usually as a result of trauma, and that speaks to the fact that for some people, gambling creates an escape, and that's more likely to be affecting females. Just another type of thinking about gambling disorder, but it's not actually listed in DSM-5. Now, how do we manage gambling disorder? Well, the mainstay of treatment is actually cognitive behavioral therapy, and CBT has been proven to be associated with reductions in the severity of gambling disorder, the frequency of gambling, and also reduce the financial losses. And in CBT for gambling, we're addressing cognitions and we're addressing vulnerabilities. So in particular, the cognitions that we're addressing are as follows: the idea that you can beat the odds of this time you're going to win. And then the second one is the idea that you have to chase losses. And then in terms of addressing vulnerabilities, we're looking at dealing with underlying anxiety, depression, trauma, and poor coping skills. And it's interesting to note that CBT has an effect at 3 months, but the effect is lost after 9 to 12 months. And in particular, comorbid anxiety and depression are risk factors for treatment failure. The other big treatment modality that is associated with a response in gambling disorder is motivational interviewing. And motivational interviewing has been shown to reduce losses. But interestingly, it doesn't actually have any effect on frequency. So it doesn't reduce the frequency of gambling. It's got short-term efficacy at 3 months, but again, the long-term efficacy at 9 to 12 months is not proven. But notwithstanding that, it's important to note that the mainstay of treatment for gambling disorder is talking therapy, either cognitive behavioral therapy or motivational interviewing. Nonetheless, people are questing drug treatments for gambling disorder. I think about the treatments for gambling disorder according to the following rubric. I think of them as opioid antagonists, anti-glutaminergic drugs, mood stabilizers, and antidepressants. So opioid antagonists, so naltrexone, and also nalmefene for that matter. These are drugs that are classically antagonizing opioids, and particularly with naltrexone used in alcohol use disorder. And 50 milligrams, up to 150 milligrams can be used to treat gambling disorder. Anti-glutaminergic drugs, so we're talking about N-acetylcysteine, memantine, and acamprosate. And again, acamprosate is more commonly used for alcohol use disorder, but these drugs have some evidence of efficacy in gambling disorder. The mood stabilizers, lithium and topiramate, the anti-epileptics, and antidepressants, so in particular fluvoxamine, Lexapro, and bupropion, Zyban. These are antidepressants that have established some kind of evidence base for efficacy in gambling disorder. Now, I have to say that there's no one magic pill, and at the moment, there's no licensed medication for the management of gambling disorder. But these drugs allow us to consider the management of gambling disorder, or at least the pharmacotherapy for gambling disorder, according to the tailoring of treatment for comorbidity. So, for instance, if we have gambling disorder with anxiety, it might make sense to use fluvoxamine or Lexapro, SSRIs. If we had gambling disorder with bipolar affective disorder and you wanted to use a mood stabilizer, so you could use lithium, for instance. Interestingly, if you've got gambling disorder and you smoke and you've got, therefore, tobacco use disorder, N-acetylcysteine or bupropion would be appropriate for that. And certainly with gambling disorder and comorbid alcohol use disorder, it would be reasonable to expect that the pre-existing treatments for alcohol use disorder, i.e. naltrexone and acamprosate, that they would have some effect with gambling disorder. Now, in Australia, it's important to understand that there's help available. So if you're watching this and you want help or you know someone who needs help, there's 2 resources that I recommend. So gamblershelp.com.au is a website that provides help for gamblers. It's also available on a telephone, and the telephone number is 1800 858 858. And then Shark also has a service called Family Drug and Gambling Help, and that's available on 1300 660 068. And you can see more details on the screen. So that's a quick run through gambling. It's, in my opinion, has to be treated as an addiction, and there are treatments that are talking therapies and there are treatments that are drug therapies. And like most addictions, it's important to consider the use of psychosocial interventions with pharmacotherapy to make to achieve optimum results. That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.